Hi, everyone. Welcome back to Injection Insight with Aaron. I'm Aaron.
I'm Lisa.
And today is going to be a great episode. We're going to be talking about everything under eyes, different treatments, different issues that people may have, and everything about it. So.
Concerns, because I feel like it's a very popular topic nowadays, a high area of concern. But then when you start talking about fillers, you see a lot of bad work, and so that's scary. So what are some of the different options that, we can go one by one?
Well, first I want to touch on, before jumping into the procedure, I want to talk about issues that people have with their under eyes.
Oh, that's
right?
true, yeah.
So, and things that can affect the under eyes. So what I see as a medical professional is I see a lot of people coming in with, they'll have either the bags under their eyes, and, that could be from puffiness from like what they're eating, or it could be something that's there permanently, and the only way to treat that would be like surgery, right?
Yeah.
There's the hollowness, which is due to many different factors, from volume loss to fat loss to not sleeping properly, different things. And then you have dark circles.
Yes.
Everybody
has dark circles, yeah.
Yeah, the dark circles. But some of that stuff, for instance, the dark circles, jumping off of that, right? It's not always from lack of sleep. It could be due to thin skin and veins under the eye. There's not, which in that case, you can't really do too much.
Hereditary, too.
Hereditary.
You have to,
your background, some people's nutrition, lack of sun. There's many different factors, but that is one. And then you have fine lines and wrinkles, which as we age, we start getting those little lines under the eye. And crepiness is a big one. Yeah, so just off, those some of the main ones that pop out of my head at the moment. But based off of that, I would say there's different treatments to do, right? So we all know right now what's the biggest surgical procedure that's popular.
I'm going to say it wrong.
Lower bleph.
Bleph, yes.
It's like the number one topic everywhere. Everybody's talking about it. I hear it every day when I'm at work. Literally every client talks about it. Now, is it for everyone? No.
I think that's an important thing to touch on because it's out there so much on social media. Everybody thinks, okay, I need this. Yeah. It's going to change. But it really does. It's not everybody's a candidate, and it can really change the look of your face.
Oh my God, yes. I think the eyes themselves can change the look of your face. If you mess with it, it could change, especially men. Men, I've seen some men do their lower bleph, and it looks odd. It looks like their cheek is connecting into their eye. It just doesn't look. They don't look the same. Yeah. It looks like there's something off, right? And it might even feminize them, which if that's their gig, then that's totally fine. But if they're not looking for that, then it's not going to really do them justice.
And it's not reversible.
Exactly. Yeah, so the thing is with the under eyes, right, you could do the filler as long as, look, I'm a big believer in treating things that are bothering you, right? So if you have hollowness and you're not ready for surgery, or you're not a candidate for surgery, that's totally fine. Do filler if it's due to the hollowness, but make sure you're doing it at a credible place, somewhere that that they have good experience with under eyes, because that can go also terribly wrong.
Well, I know you always say it's a specialty, under eye. So
not everybody should be performing under eye filler, right? And it comes with the knowledge and the education behind it, and for safety reasons, and just to make sure that it looks good. Once again, on our Instagram, if you follow us, you could see I've done some corrections on some people because they went somewhere and did filler, and it just was not. I don't know what the injector was thinking.
Again, you don't know what type of product either, what type of filler they used.
Because not every filler is made for under eyes. You need a filler, just this for anybody listening or watching. If you're doing under eyes, you need a filler that's going to be... it's going to draw in less fluid, less water. So you want to find something that's not going to be too spongy and draw in too much and puff your under eyes.
Okay, that's good. And is there somebody that's not a candidate for under eye filler at all?
Yes. So somebody one of my pre-consultations or consultations that I do is I ask the client whether they wake up puffy, and if they wake up puffy and it goes down like midday, half the day, whatever, but it fluctuates. If the person's under eyes fluctuate, they are not a candidate, because what is going to happen is they're going to put the filler in I'm going to put the filler in their under eye, and then they're going to wake up and be puffy, and it's going to look worse than hollow. Yeah. And they're going to be like, what happened? Well, because you're not a candidate. So that's the number one question I always ask, because it could be a great product, placed product in the right spot, everything, all that stuff. But if they have that issue, it's not going to be good.
And then another one that I've seen online or had heard patients talk about is Botox under here.
Yeah.
So what
So
would be good
Botox
for
under the
that?
eye is a tricky one. So I do the Botox in the eye, but it's 1 unit per under eye that I do. And it's very, 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 very superficial. I'm talking like right under. And that's going to help kind of smooth out the lines for a short period of time. It is a short period of time.
How long would that typically
and
last?
We're talking like maybe like a month.
Oh, wow. Okay.
Yeah, because it's 1 unit. 1 unit can only go so far. And
being so superficial,
it's not going to do too much. So I always tell people, I'm like, yeah, it's a nice way to soften it, but it's not gonna change it.
Okay.
It's not gonna fix it.
Okay.
Yeah.
And then I know a big one too is just like crepiness.
Yeah.
So more texture issue.
Which I feel that a lot of people, they don't necessarily have the people have the hollowness, but what I find a lot of people do is they have the texture issues, the texture, the creepiness, and that goes. There's a couple things with that. You need to make sure that you're using your sunscreen, using your under eye serums, making sure you get good sleep, making sure you hydrate properly. Those are the internal things, but you can also do microneedling, and you know how I feel about microneedling. I
love microneedling.
Right?
Yeah, it's our favorite.
It really is. But microneedling is great for collagen stimulation and just helping with that fine lines, crepiness, texture. It's one of my number one things that I would recommend. But with that being said, nothing is an overnight miracle. Yeah. They take time. So making sure that you as a client, as a patient, understands that these things take time and that you will get to where you want to be. It just may not be overnight.
It goes with the treatment plan.
Absolutely.
Yeah. And with the microneedling, you know, it's like you said, it's building collagen. So of course it's going to take a little bit of time with that. So.
Yeah, exactly.
But
it does wonders.
It does. I was going to say, I personally feel like I see results right after. At least some smoothness or texture wise. But of course it's always going to get better after.
Exactly. And there's some other options that are non-filler based. You could do PRP. Where what that is we've touched on this in a couple other episodes, where we draw your blood, spin the blood, separate the plasma, and inject the plasma under the eyes. Now you could do it where you turn it into a filler, which is Easy Gel, where it's filler based, but that lasts only 2 months. But what I would say is, if you don't want to go filler based at all, just do the PRP or PRF. Inject it under the eyes. It's going to help revitalize the under eye area and help replenish the area naturally. But once again, that would be in combination of microneedling, and it would be in combination of other treatments to help longevity and help it long term.
Yeah. So the injections of just the PRP, where you're spinning the blood, how often would somebody need to get that done?
I would do that monthly.
Oh. So that's a commitment.
Yeah, it's a commitment. It's not always the most comfortable, but you'll see amazing results.
That was another question I wanted to ask too, is the under eye area, everybody kind of freaks out about it. Because obviously there's a needle going so close to your eye and they think it's going to be so painful. What do you...
So under eye is scary, right? Nobody wants a needle coming at them, right? So the thing is, I always tell people, I don't numb the under eyes. And the reason I don't numb the under eyes is because it's not painful. There's less nerve endings under, like right in the tear trough, right in that area. There's less nerve endings there, so it's not painful. Yeah. It's more psychological. People freak out. So, and if you were to numb the area, what it does is it puffs out the area, and I won't be able to see what I'm injecting. So there's 2 reasons as to why I don't numb. But typically... I don't numb because honestly, it's just not painful. People don't feel it. I tell them, I go through the procedure, let them know how I do it. So they're comfortable. They're not scared about it. I always tell them, don't open your eyes and look at me doing it, because it's going to freak you out.
If you're seeing a needle coming
it's going to freak you out. Yeah. But so making sure that they're aware of the procedure and feel comfortable doing it, and then they're fine.
And I will say, like, I've been in the room with you quite a bit of times when you are doing the under eye filler, and people don't even flinch. We give them the squeezy ball, but they're not even squeezing it. Yeah. So I think it's just more mentally. It's
more psychological. Yeah. So the thing is that there's less nerve endings there, so it's not painful, but it's very vascular. So because it is very vascular, your chances of having bruising, it's way up there. So you do not want to do any under eye procedure right before an event. You don't want to do it. You just don't do it.
Not 3 days before your wedding.
Not 3 days
anything,
before.
No.
Don't come get under eyes and right after be like, oh my gosh, I have something tomorrow. Will this bruise go away? No.
Yeah.
No.
And you're going to be swollen too, so you want to keep that in mind.
You'll be swollen
well.
and you'll have bruising.
Mm-hmm.
Bruising can last about 10 days or so, give or take the person, their metabolism, their health history, all that stuff, But it could take about 10 days.
Mm.
So just knowing that, plan in advance, and you'll be fine. Under eyes are great to treat.
Yeah. Is there anything else that you can think of, any other treatments besides? I know
another one would be great. Would be the fibroblast.
Oh,
the plasma pen, the fibroblast. So that's an interesting one because that one has significant downtime. It does, but it works great.
It does.
It does, yeah. So basically, the plasma pen, it zaps these tiny little controlled injuries in the area that you're trying to treat. It essentially burns them, and you have these tiny dots. And you depending on what I'm treating, I go a certain pattern. But what it does is it creates these tiny little scabs, and then it basically creates collagen and stimulates collagen and fibrin and all of that.
Mm-hmm.
And the scabs fall off, and the skin tightens over time.
Mm-hmm.
Now that is not a one-time treatment. You most likely need to do it 2 to 3 times. But with that, you're going to have scabs for about 10 days. You remember?
I went through it. I did it. So yes, you look a little crazy for a while.
How did you feel? What was your overall experience? And be honest about it.
I thought it was good, but definitely, I mean, I only did the one. So like you said, you need probably several treatments. But you definitely have to balance out that downtime and whether you want to do that.
The downtime, and I always tell people with that particular procedure, you have to follow the aftercare instructions, especially with sunscreen, because if you don't, you can get hyperpigmentation, hypopigment. You can have all kinds of issues that you didn't have before. So making sure that you follow very, very precise with that procedure.
Yeah. And it is something that you can do on the lower and upper lid.
Lower, upper.
To tighten
you
the
can
upper
do it
as well.
with your 11s. There's many places you could do it. I'm a big, I love it. The downtime is what's hard for me.
Yeah. I think we have an example of it too on our Instagram of the 11s. Yeah. Anyway, so
if anybody's listening, check out Derma Beauty Med Spa and on Instagram. We have some before and afters of them.
Yeah. And then something else for the under eye, outside of having those procedures done, that will help is always using a good eye cream or serum that you have. And then I also think that if you wake up puffy, ice roller is good. In the mornings.
Nice,
that helps. And it just feels good too when you wake up.
Yeah.
And of course, always sunscreen.
I use, the caffeine based one, because for myself, I have very thin skin and I have the veins, right? So I can't really do too much. You could see them, they're dark, but from the veins. So what I do is I use a little caffeine roller, and it has like a serum, and it rolls on, and it does wonders. Yeah. Honestly, it really does.
Nice little treat in the morning.
Right, yeah. And it feels cold because I have a little fridge.
Mini
and
fridge,
I put it all in the fridge. So everything that I put on my face is cold in the morning. It feels great.
It's a good way to wake up.
Exactly. Yeah.
Well, that was good. Is there anything else that you want to touch on before we wrap this episode up of Under Eyes?
I mean, I think we've touched on everything that I can think of. If you as a listener or a viewer have any questions or have anything that you want to comment on, make sure you reach out, DM us, comment below.
Because there also are a few other treatments that we didn't touch on, and only because we don't do those in our office. Because I know there's a lot of laser treatments and things like that, but we don't do those in our office. But if we can assist you and answer any questions, you can definitely reach out to us.
Okay. All right. Well, thank you everybody for listening and watching. It's been a pleasure as always. Make sure to follow us on Instagram, Facebook, YouTube, comment, like, subscribe, share, all the good stuff. Until next time.
Yes.
And don't forget our code. Our code this week is
Summertime 50 for $50 off towards any med spa service.